aboard the Newstrack. Ever since the outbreak of the coronavirus pandemic, the India Today special investigation team has been bringing you a series of exposés that highlight all manner of wrongdoing. On the Newstrack tonight, I want to show you a special investigation called Operation Plasma Bazaar. And in this expose, you will see how some people who've recovered from coronavirus and now have useful plasma in their system and can donate that plasma to help some other corona-stricken patient recover. They're charging exorbitant sums up to 5 lakh rupees at least, starting with 50,000 rupees, and they're literally exploiting the desperation and the need of those who at that moment need plasma for their relatives. Sit back and watch this India Today special investigation.
This pandemic-ravaged world is trialing plasma transfusions to fight off COVID-19. From New York,
we need that plasma from people who were infected. We're starting a blood drive and asking those who have recovered from the virus to contact us and to donate blood.
To New Delhi.
ट्रायल काफ़ी सक्सेसफुल रहा. अगर मॉडरेट पेशेंट है उसकी स्थिति को खराब होने से बचाने के लिए प्लाज्मा थेरेपी सक्सेसफुल नजर आती है.
But running parallel to state-run plasma banks touted to be just a phone call away is a black market for the life-saving liquid. Our undercover investigation has found some recovered patients, their intermediaries, striking deals to give their plasma, the liquid portion of their blood, to COVID positives. This is Mohammad Ilyas, a resident of Jamrudpur in Delhi. Ilyas recovered from the new coronavirus in May. When our reporters posing as attendants of a hospitalized COVID patient met him to request for plasma donation, Ilyas and his nephew Asad Khan demanded 5 lakh rupees.
अभी आपने दिया किसी को प्लाज्मा इलियास साहब? नहीं दिया? तो आप देना चाहेंगे हमें?
जी हाँ, ये हमारे भतीजे हैं, लड़के हैं, इनके ऊपर में हमने सारा.
भाई असद भाई सर, आप तैयार हैं ना प्लाज्मा देने को?
जी हाँ, तैयार.
चार्ज के लिए मुझे 5 लाख बोला है मुकुल ने.
5 लाख?
जी.
ठीक है सर. प्लाज्मा देने का 5 लाख.
जी.
मतलब पेमेंट कैसे लेंगे आप?
आप बताओ पेमेंट की टर्म. हमें तो कैश बेटर होगा.
कैश पूरा
100%.
Remember, the therapy relies on altruistic donors. It was invented to cure diphtheria in the 1890s.
When people have recovered, they produce what is known as an antibody. So this Y-shaped thing is known as an antibody, and they do what's called neutralization. They neutralize the virus.
But plasma is a commodity on sale during the 2020 pandemic, at least for some recovered patients like 28-year-old Shamsher Singh. This young man was hospitalized just last month with COVID and was successfully treated. Singh is now out negotiating the price for his antibodies.
कोई दिक्कत तो नहीं ना आपको देने में? नहीं सर, कोई प्लाज्मा देने में कोई दिक्कत तो नहीं? नहीं, कोई तो. इसके अलावा ये मेरा फिटनेस सर्टिफिकेट है. वो तो आधे घंटे में पता. ये जो फिटनेस बना के दिया है. कितने पैसे लोगे? 50 के लिए इन्होंने बोला था. मैंने नहीं बोला था. लेकिन 40 तक मतलब मैंने 50 बोला था. तो 40 क्या? 50,000. 40 में फाइनल कर दिया था. तभी मैं प्लाज्मा इतना लगा के देखो. अच्छा, आप तस्वीरें चलाते हैं? बहुत कीमत है इसकी. कोई देने के लिए भी नहीं तैयार है, आपको भी पता है. कैश लगा दो सर, कैश करा दो आप. चलो, मैं चलने के लिए तैयार हूँ.
In Northeast Delhi, India Today's special investigation team met Mohsin, a middleman for blood plasma. He offered to broker a deal with former COVID patients in Bazaar in exchange for commissions.
तो भी करवा देंगे. 1,50,000 रुपये में तुम्हारा काम करवा देंगे. ज़्यादा ना होने का क्या है, जो बंदे ठीक है वो है यूपी में. अबे नुगरे जी, हमें कुछ पैसे मिले ना मिले, हमें जो तो एक काम करो कि हमारे अकाउंट में कुछ पैसे लगाओ जो हम आ जाएँ. ये नुगरे 10,000 रुपये हमारे अकाउंट में लगा तो हम तो बिल्कुल भूख के गरीब आदमी, हमारे पास तो कुछ भी नहीं है. ये कोविड के पेशेंट. हाँ, दोनों मियाँ बीवी. ये है जी, इसके बताइए. प्लाज्मा दे देंगे ना? हाँ.
The Supreme Court outlawed paid donations of blood and blood components way back in 1996. Plasma isn't a magic bullet in COVID treatment, but its illicit trade offers an opportunity to the wealthy to jump the queue, while others wait for the therapy desperately. Jamshed Khan, Mohammad Hizbullah and Nitin Jain for India Today's special investigation team.
Joining me for perspective on this India Today investigation is Dr. Sameer Gupta. He's a cardiologist, but more importantly, in the context of our investigation tonight, he's been a plasma donor. He's with Umkal Hospital. Dr. Sandeep Buddhiraja works very closely on plasma therapies, the group medical director of Max Healthcare and a senior director at the Institute of Internal Medicine. Let me go across to Dr. Sameer Gupta first. As a doctor and a plasma donor, what do you make of this India Today investigation, which shows how those who have plasma which they can donate and help save lives, some of those people are using this as a money-making opportunity and trying to extract 5 lakh rupees or thereabouts from those who desperately need the plasma at this moment?
Thank you so much, Rahul, for bringing up this very important topic. I can't, the voice is not very clear, but, I read about this in the paper a couple of weeks ago, and I was very surprised. I'm like, what is this going on? This is kind of really weird and really inhumane, so to say, that these things are happening. In fact, the person I donated my plasma to, his family member who was coordinating everything. So I asked him, I said, we were connected to a registry. So I asked him, I said, how did you find out and what were the steps you were taking? And he said that a lot of people were reaching out to him who were saying, don't do any blood test, but we have got plasma, take my plasma. And they were trying to extract money. He said, we never reached that stage where we would reach money because he felt something was fishy. But it's absolutely insane because, right now, Rahul, we're in the midst of a pandemic, right? We're in the midst of a pandemic. And the thing in the pandemic is that everyone is dependent on each other for our well-being. Now, if you think about masks, the thing with masks is that I'm wearing a mask not just for my security, but also for the security of the people around me. Because I may be asymptomatic, but if I have a mask, I will not spread the virus in the entire air around me. So the mask is not just for me, but it's also for you. So that is kind of where we are, right? We're in it together. Everybody's in it together. So donating plasma is just contributing and appreciating that, we are all in it together. We are all here to help each other. If anything goes wrong, those people who've been infected should come forward and do this. Because, if India has 12 lakh cases and 6 lakh people have recovered, that means there are 6 lakh plasma donors walking around. Now, some of them might be old, some of them might be sick, some of them might have died. But that still leads to a very large population of people who have plasma. That
Dr. Sandeep Buddhiraja,
possibly
this is a bit like your opportunity. Now, Sameer Gupta happens to be a doctor, so he can contribute in many ways. But if somebody is not a health worker, giving plasma, donating your plasma is actually your one opportunity to give back to the larger human cause in the battle against the COVID virus. Rather than that, we're seeing some people trying to think, okay, mujhe ho gaya, now how can I make some money on the side? How do you think we can put this to a stop? Because this at some level reflects human greed. What should we be doing to try and clamp down?
So Rahul, I must say that it is so sad and disheartening to see what the expose you have shown in your channel. But I think, it's two sides of a coin, and I can enumerate hundreds of stories, both from healthcare workers who have fallen ill with COVID and the way they have come forward to donate, and the non-healthcare workers, the general public, to the extent that we have had people 75 years of age who come back pleadingly saying that, we have recovered, we have survived, now we want to donate plasma, and we have to very gently and politely thank them and at the same time not accept because of their age. Similarly, people with a lot of medical issues voluntarily want to come back. Women, for example, unfortunately, multiparous women, women who have had babies in past, they cannot come and deliver unless until they have tested for antibodies which are negative. So, healthcare workers. Now, at Max, we have had over 500 healthcare workers spread across the organization who have fallen ill. And the way they have come forward, and I know of many doctors and nurses and technicians who have donated not once but twice over 2 weeks interval, and in effect they have probably potentially saved 4 lives. So I think, and at this stage when the entire world is in the most unprecedented situation and everybody is trying to do their best, and in fact humanity, there are best examples of humanity coming across. People like these, what you are projecting, it is absolutely very, very saddening and very disheartening. And I think it is our civic responsibility.
What we are seeing is
that we put a stop
some states like Delhi and Punjab have set up plasma banks. Other states are thinking about setting up plasma banks, and there's so much research about the efficacy of plasma therapy. Now remember, it's not 100%. If you get the right kind of plasma therapy, there's a good chance that it will speed up your pace of recovery. But plasma is not 100% magic bullet. It's not. There is no magic bullet, but it's proving to be useful in the battle against the coronavirus. Now, we spoke to health authorities with the results of this India Today investigation. At this moment, they are promising a massive clampdown. Let me show you part 2, which looks at how those who've been through this trauma and those who are responsible for the enforcement of the law are making of this India Today investigation.
A global drive to treat COVID-19 till a vaccine becomes available. Not a miracle cure, but studies on plasma therapy for moderately ill COVID patients have shown promising results. Survivors of the disease are generally left with antibodies in their blood. These are proteins made by the body's immune system to fight off the virus. At plasma banks like the Delhi's LNJP hospital, recovered patients wanting to donate plasma are tested for transfusion. If fit, their blood is drawn and separated into parts. Red blood cells are infused back, and the antibody-rich plasma, the liquid portion, is collected for ill patients. No incremental cost, the process relies on voluntary donors.
There are many people, particularly those who are educated, particularly those who are working in the hospitals, dispensaries, pharmacies, and those who are in the paramedics or in the paramilitary forces, Delhi police personnel. They are coming forward to donate the plasma voluntarily. And we have 2 persons who have donated plasma twice, without any motive, without any monetary gain. They just say that they are saving the patient's life.
But commercialization of the life-saving fluid, its black marketing, has left selfless donors and recipients in a state of shock.
This is a service to the society which we are making. We should not indulge in this money laundering practices, and we should try to serve the society.
I would request, more and more people to come forward for this noble cause, for this plasma donation, which can, help the patients get cured quickly. And I would also request people to do it on a voluntary basis and do not expect anything out of the patients, because, they are in bad shape and at that time they need help.
When confronted about their response to the black marketing of plasma, authorities pledged swift action.
आप हमारे को बताइए, उसके खिलाफ सख्त कार्रवाई की जाएगी. इसको तो सहन नहीं. देखो, इतना पुण्य का काम, पुण्य के काम करने के अंदर अगर उसको बेचने और खरीदने का काम, इसमें खरीदने वाला भी उतना दोषी है, बेचने वाला भी उतना दोषी है. उसके खिलाफ सख्त कार्रवाई की जाएगी.
Aside from the letter of the law, it's the spirit behind voluntary plasma donations that counts. A for-profit approach is detrimental to the essence of one human helping the other during a crisis. Bureau Report, India Today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon
to stay updated.